My I've lost my train of thought there. Hello and welcome to A Doctor's View, a podcast looking at everyday health topics and life through a doctor's eyes. Please note that all opinions are my own and should not replace the advice given to you by your own doctor. I'm Dr. Bolivios. Let's begin. Hello everyone, welcome to Doctor's View. I'm Dr. Bolivios. Joining us again this week is Dr. Haidar Al-Hakim. Haider is an ophthalmologist. He's also known as the Third Eye Doctor. He's an author and a podcaster and event host, and we have had him on the show before. As with all our chats, they are quite candid and explicit, so listener discretion is advised. We spoke about personality types and how these personality types vary within medical specialties, as well as the power of hypnosis, the cultural trend of instant gratification in society, and a few other random topics. So please do enjoy, and I hope you enjoy what will be the last episode in this series. One of the most important things that I learned from actually quite early on, I was about 18, 19 at the time, and it kind of dawned on me that everything in life is a compromise, be it the clothes we wear, the food we eat, whatever we're doing has to be a compromise. There's no way around it. And I think once you get that into your mind,
compromise is important. It's important to have kind of red lines and places that you don't want to be in and at.
Yeah.
And that's important to get that as early as possible in a relationship. That was my mistake. I found it difficult to say no to her. I found it difficult to sort of upset her. I got upset. Yeah. And yet I couldn't make her upset.
Yeah.
So
okay.
I hurt myself first,
and
then I ended up hurting her anyway.
I see.
So, now I just say it like it is. She gets upset.
Yeah.
But the intention is not there to sort of hurt them and
Yeah.
It's just being clear about what your expectations are and, sort of what your views are. So Paul's pressing a very interesting button, and it's sort of
I've just pressed on this chair. It's like, my God,
we got special chairs here in this clinic.
Is,
he's going up and down on this chair.
This is like it's like that scene in The Simpsons, isn't it? Bed goes up, bed goes down.
Yeah, and then there are these things that prod you as well in certain places.
This is fantastic.
And we get prodded all the time, mate, in relationships.
We
do the prodding sometimes on her. She does the prodding on us, and then you find a kind of compromise balance, and that's the only way. And I was going to say that now that there's a lot more divorces in the world, why is it that sort of second or third marriages are better? And that's because they just have to live with that partner to a certain extent and compromise and learn and, know that, it's not always what you want is what you get.
It's funny, one of, if not probably my most controversial episode is the one I received not very pleasant feedback on was the relationships one I did. And I just felt at the time that was true and wanted to get that view across, and like as I
was
said,
it from women or men or
it was for both.
Yeah.
It wasn't directed at any one person. It was just a generic observation that I had made.
No, I mean the complaints that came.
Oh,
to
the
you.
complaint. No, it wasn't. It was from both.
Yeah.
In the sense of how can you say that? How can you think like that? And I just said, it's just my opinion.
Fuck's sake! I mean, can't we have an opinion? Fuck's sake!
Yeah, it's
pisses me off when I can't have an opinion.
I think having an opinion is so important, and the problem is nowadays we almost feel chastised from giving one, and it's okay to have an opinion.
I've already been circumcised. Fuck's sake! Do I have to be castrated as well?
But I've lost my train of thought there.
And I didn't have a say in that, fuck's sake. It's like, mate, you're getting fucking your foreskin off.
It was I must say the thing with that was I was seeing people who were on their, as you say, their second, third marriage, and they were just bad mouthing. This wasn't recent. This actually over a few years, and the same things happened a few times.
Yeah.
And when you're in theatre and people are talking and what have you, and they're saying they're bad mouthing their other half that they just split up with, and saying that they're this, that, and the other. And I just sat there thinking, well, you're on your third marriage now. You've said roughly the same thing about all the others. Maybe the problem is not lying with the other person. I think, because the fact is from what you're telling me, they're happily with someone else now. So, and it didn't really go down too well.
Society's changed, and marriage is not what it used to be, and relationships are not what it's used to be, and it's all this instant gratification, which is the leading philosophy or religion or ideology that people sign up to now. It's literally instant gratification, and when you're having a long-term relationship, that doesn't come along. It's sort of the occasional high, but most of it is kind of not much happening, really.
The instant gratification thing, that's actually quite interesting, because I think when you look at everything we do as a society now, everything seems to revolve around this, and it, even in the products that we're being advertised, or even in healthcare, for example.
Even the drugs that sort of are advertised at us. Yes, blood pressure down by 30% within like this. Side effects? No side effects, of course.
Yes. Yeah, absolutely.
Everything has a fucking side effect.
Course.
Everything has a fucking side effect. Even long-term marriages, happy marriages, has a fucking side effect. You kind of lose that, Casanova, tantric, super sex, into the into the seventh sphere of sexual energy and spirituality. So everything has a side effect. I guess it's that sort of benefit risk thing. But going back to instant gratification. I mean, the reason why people listen to this podcast is because they know they're going to get a good laugh and instant sort of buzz and lots of serotonin and dopamine in their bodies.
When we plan to meet up again and do this, I was thinking I'm gonna come up with some questions and what have you. I just thought,
fuck it.
What's the point?
Well, I did have some thoughts about that, and I was thinking of talking about the cuntness of different medical specialties. So just like back in the day when you had those kind of knives for each specialty. Like, orthopedic had 10 knives, but we can sort of turn it into cuntness. How much?
Very good. That's you're still the only E I've got after my podcast title.
I don't know what the fuck that's all about. No doctors. Well, very few anyway. I mean, there's a very nice breast surgeon. I can't remember her name. And then she developed breast cancer. And she's doing really well health-wise. So the thing that got her through that was reading lots of books that talk about fuck.
Fair enough.
The word fuck is such an amazing word because it has so many healing properties in it. Just the word fuck, just because it's that taboo thing.
The origin of it.
No.
The word. So it was actually back in the day, God knows how many years ago, where you had to have a license.
Back in the 70s, you mean?
No. I don't know when. There's something hundreds. And it was when you had to have a license by the king to have a child. So you'd actually have a notice on your door, and it was an acronym for fornication under consent of the king.
Okay. That's interesting.
That's well, at least that's what I was told. Whether it's true or not, is a different story.
I remember reading something somewhere about how it's a very sophisticated word amongst upper class British society, and it was only used by upper class people,
Sure.
and then they felt that it was a bit. Let's demote it down to the lower class. So yeah, there's a whole history about it, but I'm not a book reader. I used to be, but that was because I was in medical school.
I've been reading your book.
Have you really?
I have been reading your book. I've actually brought it so you can sign it for me.
Absolutely, absolutely. What do you think? You know, apart from the sound bites and all that kind of.
No, I genuinely think it's fantastic. Haven't finished it yet, but everything that I've read so far is just that's pretty soul bearing. I think you set it off well. The Park the Shark, I think, was the first chapter, if I'm correct, and I thought, wow, he's really going for it. You know,
he's come out guns blazing.
It was
not leaving anything.
I thought, okay, you know, it's nice. You do get a sense of you in it, and it's interesting.
Yeah, I mean, I'm sort of revealing my soul, really, which is damaged goods, and
was it therapeutic writing it?
It was cathartic. Actually, I got worse writing it rather than better. I thought
Really?
I'd get better.
Yeah, that's interesting.
Because once you open Pandora's box,
Yeah.
or you open the black box,
Yeah,
all the worms come out,
sure.
and all the spiders come out, and you think, shit, I didn't know I was that messed up.
That's interesting. Oh yeah, I thought it'd almost be like your own therapy, writing a book, or in the same way that art, and when people do art, and I think, this.
I mean, the topic is a depressing topic. It's not as if you're writing about something magnificent and awe-inspiring, and something that really, really inspires people. So it is a very depressing topic. And when I do my talk, I say, look, guys, I'm talking about something that's depressing here. I'm quite a funny guy, but
No, you are.
do you know what I mean? But I've got to talk about this depressing topic because no one else is going to talk about it. And that's what I like. I like talking about taboo topics and topics that people are unwilling to talk about because they feel uneasy, and they do get flustered, and they do get nervous and anxious about talking about these issues.
Yeah.
And that originated from, I think, being a minority in the Iraqi community, where you have to kind of stand up for your views and rights and your actual existence.
Is that to be heard, or is that just a general cultural?
To be heard, definitely to be heard, and just to protect yourself.
Sure.
So you do get quite, rebellious and just downright rude, because you're always pushing the status quo.
Yeah. Yeah.
And but I wouldn't push my community and status quo. I'd be pushing everything else. But then I got to the stage where I can't do this any longer. I've got to push myself now. Look at my taboo things that is stopping me from being who I truly am. What were we talking about before we started talking about our book? About fuck, isn't it? You know, how it's such an important word.
And also about instant gratification.
Yeah, so it's all about instant gratification, unfortunately. And that's where it originates from, all that serotonin and dopamine that sort of floods our system.
Well, everything is dopamine release, isn't it? The whole mindset pattern, and that's caffeine releases.
Yeah,
that, everything.
Unfortunately, because there's so much benefit from not having that dopamine release and serotonin release, because it sort of clouds your experience.
Yeah.
And being in that steady state, being in that state of stillness is actually quite, I find it really powerful when I just slow down and start speaking slowly and with a regular tone.
I noticed
it's great for hypnosis. Hypnosis is amazing. I mean, hypnosis is such a powerful way because it taps into that subconscious, which is, in a sense, non-physiological, non-dopamine release and serotonin releasing,
Yeah.
and yet it's so powerful and it's untapped. And
What are your thoughts on hypnosis actually in terms of treatment? Just
it depends on the practitioner.
okay.
So it really depends on the practitioner and what are they doing with it. I know quite a lot of hypnotists who are entertainers, essentially.
Sure.
And, it's sort of great fun.
Going and
just turning them into chickens and love boats and orgy fests and so on. So
I know we were talking on when I was on your podcast, talking about the charlatans of the therapeutic world, and do you think the hypnosis world has got just as many, if
more,
not more?
Probably.
Yeah.
I mean, there are charlatans everywhere, isn't it? But because the subconscious is so powerful, you can tap into it really quickly. And one of the best ways to do that is just to close your eyes, because once you close your eyes, you're reducing your sensory input into your consciousness by 80%. And then what's left is a bit of consciousness, but there's more unconsciousness going on there.
Sure.
So it's a very, very powerful suggestive tool just by closing your eyes, being in a relaxed state, and then you can suggest what you want to them.
Wow.
And it's just that simple technique.
Yeah.
And then if you put relaxation into it, and if you put trust into it, and if you put time into it, it can get very powerful. But that's how powerful the mind and the subconscious is.
Yeah. Yeah.
And it can flip that switch that quickly.
I always thought of myself as someone that could never be hypnotized, actually.
Those are the ideal people to be hypnotized. Ideal people.
Really?
Yeah.
I'm very curious now.
Because the conscious and the logical brain is not that powerful. It takes a lot of effort. But the intuition and the subconscious and the being that you are is so much more powerful. And if you allow yourself to go into that space, the benefits are unimaginable.
Fair enough. I've always just thought I've got such a, overactive mind. If someone tells me to sit there and close my eyes, count backward, or whatever they do, I'd feel like I think I'd either start laughing or but I see your point where if you get to that state, if someone that's difficult to hypnotize actually manages to be hypnotized, then it's going to be a quite profound effect.
Yeah, it's different stages. So if you allow yourself to be suggestible, then you are suggestible. And me as a practitioner in hypnosis, I'm very suggestible. So when I'm suggestible, the other person becomes suggestible as well. So I allow myself to sit in that suggestible space. So the last time I was deeply hypnotized by my teacher, I had a trip. I had a psychedelic trip, and it just shows you how powerful it is. But I allowed myself to be in that space. And a lot of us don't allow ourselves to experience these situations. And it comes back to sort of compromise, and it comes back to, where are you willing to go in your life? Are you willing to stay where you are in the dumps and in your current situation? Or are you willing to try something different and go into a different space? And that exists. It's not as if it doesn't exist. It's always been there.
It's putting yourself out there and being vulnerable.
Yeah, you've put yourself in your logical world.
Yeah.
And you're not willing to step out of it because you're comfortable with it, you're used to it, and it's kind of worked for you for a long time.
Sure.
But there is a different world out there. And, it comes back to relationships. You're in this relationship which isn't working. And, are you willing to step out and see what's out there? And if it doesn't work, you can always come back with a different mindset as well, a different perspective.
Yeah.
So it's all these different perspectives. And the thing with hypnosis is that it does give you a different perspective. So I did a talk for some physicians and surgeons in Basildon. And the title was how to hypnotize your patient.
Okay.
So what I did is I literally hypnotized the doctors.
Awesome.
So I hypnotized about 12 doctors, and 7 of them were rolling around on the floor, hugging each other, and believing that they were pillows for each other, and it was quite a scene.
Wow.
But there were a few doctors there who were just horrified by this talk. Horrified.
Why?
Because it wasn't logical, because it was pointless. Because how am I going to relate this to my
Practice.
How am I going to write this down as a reflective prose for my appraisal?
Yeah.
I was demonstrating to you the power of hypnosis, where these grown men and women who are super logical, super skeptical medics rolling around like crazy beings.
Well, it's playing a part in anesthetics now as well.
Yeah.
Hypnosis. I've met people who use it as part of their anesthetic. Of course, they still give medication and what have you, but the effect it has, the calming effect it has in the anesthetic room, and just the amount of drugs you need and all the rest, it's quite profound. There are some studies on it. I need to look into them more to be able to talk about it more, but
I mean, people like me, we don't like doing studies. It's like we do it, we don't have time for all that study palaver. That's how Achilles heel is. Mate, we're just too busy doing the work, and we're not out there fishing for funding. So back to the sort of hypnosis session.
Yeah.
There was quite a senior member from the GMC, because they did a talk before me about the GMC and requirements, blah, 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 And she was horrified. And she came to me after the session, and she said, "You can't do this. This isn't right. You're going to be in the papers."
I can imagine your response was good.
Well, actually, I had a T-shirt at the time. It said "Lions, not sheep."
Very good.
So I was wearing my jeans, and I had a black T-shirt in with white type saying "Lions, not sheep." And she came up really upset. She came up to me before the talk.
Yeah.
"Oh, I'm a tiger." That's the first thing she said to me. And I was like, "Great, excellent, well done." She got so upset. It's like, "Well, I'm blah, blah, blah from the GMC." And blah, blah. I said, "Wonderful, great." I said, "Look, just hang around for my talk. You'll enjoy it." I so pissed her off.
I'm sure.
I so pissed. And then after the talk, she was just horrified. She goes, "Oh, you're going to be in the papers." And I was like, "Okay, fair enough." I mean, I didn't want to aggravate her, obviously, but she wanted to create a scene. But it was quite nice because there was a famous professor of obs and gynae there, and he was like writing all this. I thought people actually some people take this seriously, because before I was just doing it for a bit of fun, really.
Sure.
Because we like doing stuff that's fun, isn't it?
Yeah, everyone does, of course.
Do you know what I mean? I mean, that's why we do what we do. That's why we do these things, and I found it really fun doing this hypnosis stuff, because it just showed you how powerful the subconscious is, and you deny it at your peril, because that's how the media works. That's how politics works. That's how all of these major forces in the world work, is that they speak to your subconscious on a continuous basis, and and they cause that agitation under the surface, and then it sort of filters into your conscious as being obedient consumers of general society, and in terms of doctors, being obedient doctors in the medical profession.
Yes, you want something, you don't know why you want it, you just want it.
Yeah.
And
I mean, with the current election going on, there are all these different subconscious messages that's coming across because they do have a plan in order to steer the country in a certain way.
yeah,
And I'm not a conspiracy theorist. I'm not saying this is what's going to happen, but that's how powerful the subconscious is. And when I did embrace the unconventional paths of consciousness, it opens up a new world. And us being physicians and therapists and people who are there to help the well-being of other human beings, we should at least accept it as another mode of therapy.
yeah, that's fair enough. I don't know if we use hypnosis in the NHS much. I'm a bit ignorant on that.
Well, just being suggestible or suggesting something to another human being, that's a process of hypnosis happening.
Okay.
Okay, so hypnosis is that process of where you learn something new from a suggestion. That's in its simplest form.
Well, okay.
That's what hypnosis is.
Yeah.
And human beings are born to learn.
Yes, we are.
That's it. That's our purpose in life. We're here to learn. Otherwise, we don't survive. We die. We've learned from our previous podcasts, and you've done quite a few now, and you've learned a lot of things.
Yes.
And that's kind of come really subconsciously rather than logically.
Yeah.
Because it's so much more quicker and powerful.
I think someone actually said, there's a difference between your first one and, the more recent ones in terms of the way you speak or the editing levels or this and the other. I thought, do you know what? I haven't actually thought about.
There you go. It's, not this conscious thing. It's all happened automatically, so to speak.
That's interesting.
That's the power of self-suggestion.
Yeah, I guess you don't notice yourself getting better at something. It's like when we, from your situation in terms of surgery, you don't notice the day that you get faster at suturing.
Oh my God.
It's
crazy, isn't it?
It happens, doesn't it?
And, you see this when you're anesthetizing, different patients. You see the surgeon evolve as a surgeon. You think, wow.
Yeah.
Things change. And, that's the power of hypnosis. That's the power of self-suggestion. That's the power of the, coming back to the collective subconsciousness or the collective unconsciousness. So I was on a podcast at the Royal College of Ophthalmologists, and we talked about that. The importance of having a culture of learning and helping each other out. It doesn't have to be conscious, but it can be subconscious or unconscious.
Sure.
So coming in with that intention.
Yeah.
That what I'm doing, I'm improving, which will mean my colleague will be improving, which will mean the whole profession will be improving. So that's all a subconscious mode of benefit.
It's actually quite well replicated in children and also in animals as well. So this I touched on when I was talking about homeopathy, because scientifically it doesn't work, and the power of the placebo effect. And people are saying, well, my kid got better with the homeopathic cough medicine, and if you look at it, there's many studies that you can see that kids are very much influenced by what's around them and by the people that they look up to. So if you give off the impression that you're better because you've taken this medicine, and you give off these vibes, as it were, that child will respond to that in the same way that when you're sad, your dog becomes a bit sadder. It's the same. They're very suggestive to this, and so it just elaborates on the point that we are very suggestible human beings. So
and the better you learn, or possibly are more successful in life, the more of that hypnotic power you're using. And being an eye doctor, I mean, the eyes are powerful, fuck's sake. Just looking at someone's eyes, you can tell all sorts of things. All sorts of things.
Go on.
I mean, I've got the excuse of looking at people's eyes because I'm an eye doctor.
Mm.
And I've always looked at people's eyes when I was younger. But because I was a child, when I get that sort of anger reaction or, that sort of staring reaction, I'd look away because I didn't have the self-confidence and the maturity of understanding the different energies and reactions and emotions that you can read in people's eyes. But there is a lot of that.
Yeah.
There is a lot of that in people's eyes, and the more I look at people's eyes, the more I feel more comfortable about them.
Sure.
And it's just a hunch, I think. For me, I am an intuitive guy.
Yeah.
And it's all about hunches for me.
I saw you on TV, actually.
Yeah, really? Yeah.
I saw you on TV, and I showed my family as well because they were.
Oh dear, are you trying to marry me off to your family or something?
No, what
I can
had
have a
happened-
second wife if
Well, I didn't actually.
if she's got the dimensions and stuff like that.
I didn't actually say who was.
Oh really?
Yeah,
yeah.
And someone said they recognised your voice from the podcast we did earlier, and I got, isn't that the one who swears a lot?
Yeah, fucking hell.
And,
I'm trying to get on a podcast with someone,
yeah.
right? A GP, and he won't put me on because I swear.
Oh dear.
And I'm thinking, guy, just grow up, will you? I mean, we watch films with swearing in it.
Yeah.
I mean, what's the difference? And this film is supposed to be something that's similar to real life. And people who are being kind of real, they're not real, but kind of real. And can't you accept that some people just can't keep it clean?
You were very well received, actually, and you came across very professional on the.
Well, I couldn't
the
swear
show.
on that channel because it was an Islamic channel, and so I have to not swear at all on it. Otherwise, I wouldn't be invited back on. And also, I had to sort of paint it with an Islamic flavor as well, which is fair enough because that's my culture.
Sure.
And then I got seen by one of the producers who produces a political program on there.
Okay.
And he thought, fuck, let's do some politics with you. As in, let's get you on the politics show. I said, mate, if I'm going to get on politics, it's got to be satire and just fucking making the, taking the piss out of politics, particularly cultural, Islamic, religious politics, which for some people is an absolute minefield. For me, it's fun.
Did that go down well? Or
He loved it.
okay, good.
He fucking loved it. And, we had a 2-hour I had a 2-hour meeting with him.
Yeah.
And he fucking loved it. But obviously, we've got to cut out a few, F words. You see, I have to sigh when I say these.
I could see the enjoyment just drain from your face as you just did
it's
that.
like, racist, sexist, socialist, whatever you want to call it, is. And I'm not for public office, for sure. Because if they can, take out my tweets, I'll be in trouble, But I would like, if I was a proper politician, a proper liar and, sort of diplomat, it would be conservatives for me, for sure.
Your tweets are quite clean, actually, thinking about that.
Yeah, I don't know why, but I'll probably change it from now on because I've got quite a lot of nice...
followers.
Sort of, no, I mean I'm not really into followers, to be honest.
Okay.
I'm into creating agitation and discomfort in people in a good way, so that they can come out of their rut, basically.
Sure.
And I have this thing inside me thinking, oh, this guy needs to be ruffled a bit, because for me, like the third eye is where your chronic pain is, where your chronic irritation is, and you're not willing to go there. I make you go there.
Yeah.
You got to go there, mate,
Yeah.
and get fucked up before
Yeah.
you get better. So I kind of fuck you up a bit. Agitate you into some kind of elevating, butter-forming existence.
Do a lot of therapists do this, or is this your
No, that's my way.
way?
Yeah. Yeah. I think everyone's got their own way, isn't it?
Yeah.
Everyone's got. I mean, I've always been a bit of a, people used to always come and ask advice from me, even from a young age. And I remember the first time I was 11, and some grown man came to me about certain stuff,
Yeah.
personal stuff, and I kind of irritated him. Rather than being nice, I said, "Well, have you thought of this? And why aren't you doing this?" And
Just make someone feel a bit like an idiot to some extent.
well, not an idiot, but just sort of create that kind of tension that they know that they need to do and move on.
Yeah.
Otherwise, they're stuck in this place, and it's their soul or their third eye or whatever that's unseen inside of them that's just fucking them up inside, and not allowing them to move to the next level.
Yeah.
And I mean, for me, it's what gets me out of my state is, my sort of family giving me a good rollicking.
You need it to keep you in check, and that's for everyone. I think
we've got to keep evolving, isn't it? We got to keep evolving.
Yeah.
Otherwise, you're in trouble. Otherwise, you turn into, mother care and. Who else has gone down the pan? Toys R Us and...
Oh, yeah. I was quite sad about that, actually, to be honest.
Yeah, my daughters were very sad.
Yeah.
They're like, Dad, no more Toys R Us. I'm thinking, yes, thank God. Our sort of, regular timetable was sort of weekly Toys R Us visits. And, yeah.
I remember
kids can't get enough of toys. But then we can't get enough of that dopamine and serotonin fix, can we?
No,
we've got to keep going.
I mean, even as adults, I still love toys, but they're different forms. They're gadgets. They're
fucking hell. You've got like the full shebang here. Fuck's sake, it's written professional everywhere, and I'm thinking, fucking hell.
Yeah,
you should see my equipment, non-existent, mate.
What your USB microphone?
Yeah, it's like, fuck all, mate. I'm thinking, bloody hell, this guy loves his shit.
I think I'm trying to get to the point where my content and my ability to use the equipment is as good as the equipment, and it's taking its time. But
as long as you stick with it, I mean, that's the thing.
Yeah.
Because technology, as long as you stick with it, it sort of gets better.
Yeah.
But we are addictive machines. You know, that's how we're made. Is that we get addicted to something really, really quickly, and that's fine. If it's benefiting you, great.
Yeah.
Keep doing it.
Yeah.
And the question is, do you attach other connotations to that addiction? And then once you attach, for example, shame to that addiction, that's when it gets very damaging.
As in damaging to
you. Yeah.
Okay.
Particularly if you've got individuals around you who attach that. Shame, and this happens on a subconscious level, so they're actually hypnotizing you into believing that it's shameful to have this addiction.
Okay.
That's hypnosis at work. Or it could be society that's hypnotizing you to think that the addiction that you have is shameful or should be brushed under the carpet.
Yeah.
Or should be taboo.
Yeah.
That's hypnosis at work.
That's interesting.
Yeah.
Yeah, never thought of it.
Yeah.
Wow.
Well, you think too much, isn't it, Paul? That's
yeah, I know. It's
it's a habit.
It's a habit. It is a habit, and it's can be a bit detrimental sometimes because you're overanalyzing something.
It just slows you down.
It does slow you down. It has sometimes some uses, when you're
sure.
But there's a lot of times where I see people just going for doing something and
just blast it through,
and not actually giving much of a calculated thought, but not much of a
I mean, there's different personality types and so on. I mean, for me, it's I know it's right and I just do it.
Yeah.
And once I start analyzing things logically and thinking about the consequence, it just doesn't get done, and then I don't know how that's going to affect me. I know how it affects me if I calculate everything. Nothing gets done.
Sure.
If I don't calculate it and just do it, then I get the consequences, and then my subconscious deals with that.
Yeah.
Rather than my consciousness.
Well, actually, on the note of different personalities, and we had loosely discussed about talking about different specialties in the hospital and different personality types that are associated with those specialties. And anyone listening or who wants to
we love you all.
Go into
we have nothing against any of the subspecialties whatsoever, and apart from the orthopods.
Words of Haider. Words of Haider. And
I mean, I don't know. I haven't met many nice, unless they work in the NHS doing hip replacements. I'd call that a nice orthopedic surgeon.
I worked with quite a few, and I've definitely met some lovely ones. I honestly have, and not just saying that. There are some nice ones, but definitely the one thing you do notice is there is definitely a personality trait between the different specialties. I can see it.
Yeah.
People may argue against it, but I think it's there. And
what are anaesthetists like?
Very methodical.
Yeah.
We've got a lot are in the introvert side of things. I feel.
Yeah.
You do get obviously variances within this, but I remember when I first joined a trust, we actually did like a very, very quick, personality thing, and there was 4 different colours. There was red, yellow, green, and blue. I think were the colours, and red being your extrovert, fiery, argumentative person, and I can't remember which one was the opposite side of the spectrum. I think it was the blue, to say that you were introverted, agreeable, etc. And the anaesthetist would tend to be in that side of things, whereas the surgeons would be in the red. And it just goes to show, and it wasn't, it's not an engineered thing. It's just the way it naturally filters out. And I noticed this actually going into med school. We were almost a friend and I. We were going around, sort of looking around the lecture room, as it were. And you could you knew who was going to be the orthopod. You knew who was going to be the GP. You knew, and it was just purely based on their personality. And when we go through news feeds and what have you, it's like, we were right. I just wanted to ask firstly, how your personality fits within surgery, because you're an ophthalmic surgeon.
Yeah.
And what your thoughts are on that, different personalities doing different specialties.
So, in terms of ophthalmology, it's pretty much a surgical specialty. So, narcissistic, sociopath, not good with patients, and money kind of thing. So that's that was the kind of mindset that I had training in ophthalmology because of the competitiveness within it. But then when you start working with ophthalmologists and you start working within that environment, actually you see different arrays of personalities.
Okay.
So, for example, those qualities that I talked about are found in vitreoretinal surgeons. So they're like traditional surgeons who are doing hundreds of hours, rarely seeing their families, and just nasty people that can't get on. They can't switch off that narcissistic quality once they leave the theatre.
Yes.
They just keep going. Throughout the rest of their life, and their relationships break down, and they're a bit of a train wreck, really. They're sort of sitting there in their Porsches, alone, or with another money-minded individual, material-minded. So obviously I'm generalizing, guys.
Of course, it's
but that's the kind of vitreoretinal, really hard ophthalmic sort of subspecialties. So ocular oncology is quite demanding as well. Where you've got to put radioactive plaques into the eyes and do some fairly invasive stuff. The refractive surgeons, have lost the plot as well. They're a bit like aesthetic and plastic surgeons, very up their arse kind of thing, and this is the only thing that matters, my specialty, and nothing else.
Do you think that's true of everyone's?
No, I mean,
viewpoint?
I think going through different sort of subspecialties in ophthalmology, you've got the generals are pretty good.
Sure.
Very general, down to earth, medic, stroke physician, stroke surgeon.
Yeah.
They're quite approachable, really nice people, and so on.
Yeah.
You got the pediatric ophthalmologist. I'm going to get shot for this.
I'm sitting here thinking, I'm sure you work with a lot of these people, and
totally lost the plot. But even then, I remember working with someone who was absolutely nasty
Yeah.
piece of work. I'm sure he was on some kind of stimulant. And then in the same unit, you had another pediatric ophthalmologist who was the nicest ever.
Sure.
I think that was because of her emotional intelligence, or high level of emotional intelligence.
Yeah.
And then you have the very talkative, intellectual, logical, who can pretty much BS themselves out of anything, and they were the neuro-ophthalmologists. I don't know what it is about neuro stuff.
Neuro stuff. Do
You
you know?
they it's like, I don't know. They can come up with all kinds of weird and wonderful stuff.
Yeah, I've never done a neurology placement.
Really?
And I've very rarely had to interact with neurologists. So I don't really know their personality trait, actually.
Neuro-ophthalmologists are very outgoing, extroverted, very talkative.
Sure.
Intuitive, and I guess it's this thing. If you can't let your hands talk,
Yeah.
you make your mouth talk.
Sure.
Something's got to talk.
Something does. Absolutely. Always. In terms of personality traits growing up dictating what specialty you're going to come into.
Well, coming from an Asian background, it's, the bigger the better. So I think when I grew up, I wanted to be a heart surgeon.
Yeah.
The biggest, baddest surgeon in the world kind of thing.
Sure.
That was my mentality when I went in, and it was between brain surgery or cardiac surgery. So
the sexy titles.
It's like that's it. Working 24/7.
Yeah.
And just be a Superman. But then reality struck, and I did a 8-week placement in a neurosurgical unit. I thought, no fucking way.
Yeah,
I'm not standing here for 12 hours on, messing with someone's, anastomoses.
I met a lot of students over the years, and they always say, I always ask them what specialty do you want to do, and some of the responses, I'm thinking, really, why? And they give me all these reasons. I'm thinking, it's really nothing like that. What you've got in your mind, what you want it to be, what you expect it to be. And I just say to them, just be open-minded.
Yeah.
You haven't finished med school yet.
Yeah.
Wait till you start going around your rotations in your foundation years. And what I found with the foundation years, it doesn't tell you what you want to do specifically, but it does tell you what you know you don't want to do.
Yes.
And so I knew I didn't want to do a medical job, like a cardiology job or a respiratory job, because I'll be honest, I'm not the biggest fan of ward rounds, and I'm not. I like doing things with my hands. I like interacting with, and the thought of doing a 8-hour ward round would drive me insane.
Yeah.
Whereas for others, they think that's the best thing, and that dictated.
I mean,
my specialty.
that's what I told Elliot when I was on his podcast.
Mm.
You know, the secret to life is not knowing who you are, is knowing who you're not or what you
Yeah.
don't want to do.
Yeah.
If you can suss that out,
Yeah.
that is like amazing.
Well, I left surgery to
Yeah.
do anesthetics after 3 years. I left surgery, and I was actually told by a lovely consultant when I was doing surgery at the time. He would say to me, Paul, you say all the good things and compliment, the way I talk to patients and yada yada yada. He said, "You're not a surgeon. Please don't take that in the wrong way. If you want to continue."
Why do you believe him?
I didn't actually,
Oh.
but I found it interesting that he made a point to say that I'm not the personality of being a surgeon, and I said I don't want to continue with surgery. I didn't believe it's because I couldn't do it or because I not a surgeon. I don't really know what that means. I think anyone can do a specific thing if they want to, but I knew what he meant, and what he meant was I like spending time with the patients. I like doing certain things on the ward, or coming up with a management plan of certain sorts. And this didn't lend itself to the surgical training, as it were, in that as I was doing that, I was losing time in theatre, gaining numbers and what have you. So I think, and he did elaborate, and that is what he meant.
Yeah.
But I just found it interesting, and I've seen other people who have been told you're not a medic, you're not this, you're not that. And it is strange how in medicine you've got all these different, it encompasses all these different personalities and specialties.
You've got to, literally be so flexible and fluidic and not be rigid in your ways, and accept that you may end up going down a certain path for many, many years, and then you find that it's not you. And I think that's a really good thing.
Yeah.
It's a really good thing as you being a physician, to experience all these different specialties for many, many years, because it'll only increase your perspective. So when you do have a situation where you at least can understand and appreciate where the patient's been through. So if they've been through an orthopod, if they've been through a psychiatrist, or if they've been through a pediatric unit, they know exactly where they've been.
Yes.
And then we sort of alluded about this earlier, is, eventually we all turn into GPs. Eventually we all turn into general practitioners because we've experienced so many different things.
Yeah.
And if there isn't one specialty that totally satisfies you, there are so many other alternatives there. And, for me, I've sort of gone round the blocks, really. And I knew I didn't want to do medicine for sure, because it was just too rigid and too blocky. And I couldn't remember all the dosage and all the protocols. And
there's a lot now.
And plus, I used to get too deep into the situation. So if it was a chest pain, I used to get really like, okay, could it be this? Could it be? Rather than just a very basic algorithm you go through, because I found it so unstimulating just to go through that typical algorithm pathway for another chest pain.
Yeah.
It was soul destroying for me. I just thought, I can't do this. And then when I went down the surgery route, okay, surgery is great and so on, but I found that that sort of isolation and that time that you spent away from stuff, from family, from friends, and so it was just too much for me.
Yeah.
Just spending hours and hours on the operating table.
Yeah.
I wasn't in flow, and that's the thing, guys. What is it that puts you in flow? What is it that increases your focus and increases your energy and increases your presence and increases your awareness and increases, your ability as a human being to shine?
Yeah.
If that specialty takes you away from that, you're in the wrong specialty.
Yeah.
And you've got to be big enough to accept that and move on and go and find something else.
Yeah, I agree with that. And I've been criticised by what I would say was a dry person in the past, and I was on a date a few years ago,
Yeah.
and we was talking about work and all the rest, and I'd explained that I left surgery to do this, and she asked me, why did you leave surgery? And I said it wasn't fun for me anymore. Very simply, just I didn't find it fun anymore for me. And this was greeted with this response of, like, I just handed someone a dead puppy, you know. And it was like, but it's work. It's not meant to be fun. This is what I got. And
that's what my boss says.
What,
Keep saying that to me fucking every day.
But and I just looked. I thought, no, you're wrong, because I'm there so many hours a week. I'm there so many hours of my life, and I want work to be fun.
Yeah.
We're doing something that is responsible, and and someone's put their health, and in some cases their life in your hands, in your team's hands, and you've got to be able to enjoy it as well as obviously act professionally, act responsible, of course. But when you can't make a joke, or you can't inject a little bit of personality and humor into your vocation, I think it's in the wrong. You're in the wrong profession.
Yeah. I mean, I've cut down surgery to just once a month, and I probably reduce it to once every 2 months. And I met my previous surgical boss about 3 years ago, and he saw me, and hello, how are you? I said, fine. He goes, well, what are you doing? Well, I said, I'm coaching now, and I'm doing psychotherapy, and I'm doing hypnosis.
Yeah.
And he looked at me in such a shocked manner. It really hurt me. And he said, "Oh, but you're a great surgeon. What the fuck are you doing?"
Mm.
And I looked at him really annoyed. It really pissed me off. And I said, well, I'm fucking enjoying myself, because, I didn't use those words. I just stopped the conversation. I said, well, I'm happy where I am, because, he wasn't happy in his job.
Yeah. Okay.
I used to literally go there and counsel him.
Sure.
As in, go into his room, and we'd have about 15-20 minute chat between patients, talking about how he hates his job, basically, and how he wants to retire. He's watching his villa. He's got a camera in his villa in France. That's what he does between his patients.
What looks at the phone screen, and
he's got some online camera, and that's how he gets through his day. And I'm thinking, mate, I don't want to be in your fucking situation. The guy is in his 60s.
Yeah.
And he's having a go at me for not doing much surgery, even though I'm a good surgeon. Yeah. I'm a good surgeon, but it's painful for me. Because that's not who I am.
Yeah.
It's painful. And that's why I burnt out when I went to Iraq, because I was struggling. I was doing a good job for the patients, but I was struggling. I said, no, this has got to stop, mate. I can't do this anymore.
Yeah.
And, that's where sort of society controls you and changes you, and your culture controls you and changes you, and your profession controls you and changes you. And you end up being a figment of who you were when you were younger and a child and a teenager, and
shadow of your former self.
Absolute shadow. And and having that conversation with him really allowed me to know where I don't want to be. It's like, right, okay, I get it now, because he made me realize how miserable he was for him to say those words to me.
Yeah. You don't need to,
it was obvious
someone.
That he was really, really upset.
Yeah.
Maybe he was, he was upset that I changed, but I've had that from a lot of doctor friends. You know, they come up to me and they say, Heidi, you've changed so much. What's happened to you? And it really pisses me off when they say that.
Not in a complimentary way.
Yeah, I mean, you know, like we have an interaction, and you know, before I used to be really nice and, you know, very accommodating, and I used to subdue myself and who I was. And now it's like, well, this is who I am, take it or leave it. And they get really upset. It's like, what happened to the old Haider? The nice guy.
So you're appeasing others.
I've stopped pleasing others. I've got to please you, though. I've got to please you. But that's coming back to compromise, isn't it?
It is. It is.
It's coming back to compromise. And, yeah. So going back to the different specialties.
Yeah.
I think they've just got to try everything until they slot into something that's really, really, you know, them.
Yeah.
And, you know, because of general practice, you can pretty much do whatever you want and still be within that.
Within the remit of what you expected and what have you. Yeah, it's true.
You know, you can be a gypsy. And,
a gypsy.
If you're a gypsy, that's it.
Yeah, for those that don't know, gypsy is GP with special interest.
Yeah.
It's an acronym. And
maybe that's the way forward. Everyone's a gypsy until proven otherwise. So, you know, we're all general practitioners with a special interest. And I don't think that's a bad thing, because then you sort of, you do everything about the body rather than someone who specializes in earlobe cancers.
Sure. What are your thoughts on horrible people? And I can say this in that.
Horrible medics or horrible?
Yeah, I was going to say. So I've worked with a few people in the past who I would go home and just think, you are a vile human being.
That's said in such a nice and eloquent way.
Yeah,
Paul, well done.
Thank you. And
I say he's a cunt or she's a cunt, and you know, that's it.
To be honest,
you know, they're the cause of our problems, really.
I mean,
you know, in our profession,
purely
you know, the reason why we have problems in our profession is because of these people.
Yeah, it was, when I say bullied and victimized, I mean it in true sense of the word, and it made me miserable working under these people, and it made me realize that, because there was one in particular within this firm, one surgeon who was lovely. He was so polite, so nicely mannered. It was a pleasure scrubbing in with this man. He was, if he accidentally bumped into you, I'm sorry, you know, and you'd sit there and chat, and it was lovely. And he was fantastic surgeon, and it made me realize, I thought, you know, why does competence and kindness have to be mutually exclusive? But then I used to be
like that, you see, Paul. I used to be that person.
What, the nice person?
The nice person.
Sure.
And people all used to love me, but it wasn't me. You know, that was the kind of, you know, so that was damaging for me, because I used to put all my feelings and hurt and problems that I was having under wraps.
Yeah.
And I'd come into work, all this, you know, whatever, nice person and lovely jubbly, whatever, and then go home and you know, try and
sort of explode in a way, just
explode,
eventually
I explode. So I mean, I'd be suspicious of these individuals who are really, really nice, because they don't exist. But coming back to the really nasty people, you know, who are naturally nasty and so on, you know, they do need help. They do need help, and you know, this is talking in hindsight. You know, with sort of grey hairs everywhere. You know, these are the people that need a lot of help and a lot of support. Yeah. But there's no capacity within the system. You know, that's the thing.
I'll be honest.
You know,
I
there's
almost
no capacity. There's no time.
I almost feel they enjoy being that person sometimes.
Yeah, I mean, I think it produces results. I don't think they enjoy it. You know, it gets results.
Yeah.
You know, it gets shit done. And, you know, like anything in life, you know, if you do it over and over again, it just becomes normal, and Unless they're really evil and there's,
It's just it was getting to the point where you couldn't have a conversation. You would say hello, and it would inevitably end up with being shouted at for something,
Yeah.
and it's just you.
I don't bother with these people. I just ignore them. And I had a senior consultant who we literally nearly came to fisticuffs with each other.
Sure.
And just got on with my life, ignored him, move on. There's 7.4 billion people out there.
Yeah.
And if he kicks up a fuss and a complaint, well, you just deal with it.
Yeah.
There and then.
Yeah.
People have bad days. People have bad mental states. But I think sort of true evil characters and so on, I think they're really, really rare, and they don't really exist.
Sure.
And
Sure.
Unless they go totally off the rails, and sort of there's not many of them out there. But yeah, I just stay away from these people.
No, that's fair enough.
At
And
all costs. I think I wrote about it in my chapter about really, really nasty people and what to do about it, and how to move forward with it. And it's just having these different practical steps of staying functional and practical and pragmatic in these different situations.
I think going back to the different personalities and everything, I think one of the lovely things in medicine, as it were, is it's very difficult to say I don't like medicine, because there's so many different avenues you can explore.
Yeah.
It's almost there is a specialty for everyone, and there's a subspecialty for everyone. So you can be one of 100 different personalities, and you will find something that fits you. And I just wondered what your thoughts are on the Morris-B type tests when you're younger, because these are the career aptitude tests that we get. And I remember being at school and being forced to some extent. It was classified as optional, but it kind of wasn't, of doing this aptitude career test. And I said I don't need to do this and pay for it as well.
Wow.
And they said, no, you have to. I said, I know what I want to do.
Sounds like revalidation, mate.
Well, yes, it was in a way. And I said, I want to do medicine. I said, there's nothing else I want to do.
Yeah.
And 3 hours this test was. And it took ages. It was really boring. It was all the usual kind of things. And we waited 2 weeks for the results, and it came up with, you are best suited for a career in medicine. And this was about £200 to do as well at the time. And it was just absolutely ridiculous. I just wondered what your thoughts are on this from a psychological point of view.
Personality is a fluidic entity. So your personality is constantly developing. So personality depends on your culture, your language, your health, your wealth, your career, your life situation. So there isn't just one personality type. There are certain situations where you're an extrovert, there are certain situations where you're an introvert, there are certain situations where you're really intuitive, when you're not intuitive. So I don't really believe in this sort of, you have a fixed personality, which means you have a fixed career. I'm not into that at all. Before I was a total introvert.
I'd never know that now.
I was an absolute introvert and super logical and scared of intuition and wouldn't do anything unless, I've calculated it in my head.
Yeah.
And I used to get really socially anxious and never speak up and just stayed quiet.
Yeah.
Totally. If I went into any situation, I'd be the quietest in the corner, wouldn't do anything whatsoever. And this went on for a long time because I was conditioned that way.
Yeah. Yeah.
It doesn't mean I had that personality, but then it was reinforced by everything else I was going through. And then I went through another situation. Then I went to Iraq, and then my kind of extroversion came out because that was the thing for me in that situation, in that culture, in that life cycle I was in. And then something else happened, and then I became neither extroverted or so it's a constantly changing personality. For you to say I'm this or not that, it's sort of quite small-minded of you to say that.
Okay.
And for you to say that this is the only specialty that I can do or want to do, that is quite small-minded of you. I think you need to embrace all the different spectrums of personalities. That's coming from a holistic approach, and embrace that you are different personalities in different situations. Yes. So I'm a different personality that's talking to you. And then when I'm with a work colleague of a different type of personality type, I'm also a different personality type. And with another colleague who's totally different, I have to be totally different with that. I think it's good to have that flexibility of personality. Yeah. And it just shows you your maturity of existence and being a human being, that you're able to be this, kind of personality chameleon, social chameleon. That's really important. And only through experience, only through fucking things up, and only through making mistakes and being an absolute arse, being an idiot, being a nice person. I've tried the nice person, that's nice.
Yeah.
But it doesn't always work for me. Sometimes I do it, sometimes I don't do it. So I think you need to have that flexibility in personality.
So here's a conflicting perspective to some extent. With this being able to sort of change and sort of being one type of person with one person, another person in the other, is that a way of trying to get everyone to like you? And because I was doing this a lot, and I was mirroring the other person. So there was people, I could never find someone to say a bad word about me in the wrong way, in some extent, because people are like, oh, he's a nice guy. And
what was that doing to your energy levels?
It made me really down, actually.
There you go. So it depends on your energy levels. It depends on your life force. It depends on your level of sparkle in life. Your level of being alive.
Yeah.
We're not talking about happiness here. And we're not talking to a certain extent about contentment. We're talking about actually living, and having a meaningful and purposeful life.
Yeah.
Something that's worth living about. When your life becomes not worth living, or it doesn't have meaning, or it becomes, nihilistic, I think there's something wrong going on there. And you need to work on yourself and think, what the fuck's going on here? So answering your question is, what's your energy levels like using this particular personality type or behavior or habit with this other person?
Yeah.
And if it's draining you and destroying you, change.
Yeah. I think the key for it was realizing that not everyone can like you and accepting it.
Yeah,
I think
and that's very powerful.
Yeah. I think
that's very powerful. And, which is why I'm cutting in right now and sort of just saying these words, because I feel, do you know what I mean? Yeah. I'm not sort of waiting for you to sort of, and you understand that.
Of course.
You sort of, the way I sort of interacted there. It's just being comfortable in your own skin. And as long as you're not being an arse, you can do that by being an arse as well at the same time. And it works to a certain extent, but then it sort of bites you in the arse afterwards.
Yeah.
And I've been bitten in the arse many times. I sort of come back thinking, shit, I fucked that one up. But then it felt good, do you know what I mean?
Do you ever look back at some of the things you've said and done?
Always, mate. Always. I'm like, fuck. What the fuck did I do that for? But hey, this thing about, I don't regret. I mean, I know where that comes from, because it's made you who you are, and you've learned all these different difficult lessons, and you got your scars and so on. But I regretted so many things that I've done in my life, particularly with the way I've treated my family and sort of close friends and really good friends. I've developed years and years of good relationships with someone,
Yeah.
and then just sort of one thing and it sort of all
Just
fucks up, and I think, oh shit.
so easy to destroy something, isn't it? Just yeah.
You know, and what can you do? You totally regret it, and do you learn the lesson? Sometimes yes, and sometimes no, because
Yeah.
you know we're just humans, man. You know, it's not as if we're fucking, and
Mm.
particularly doctors. You know, we're sort of considered as these sort of untouchable, untainted examples of demigods walking around in society.
Yeah, it always makes me laugh when I look through like a car magazine and in the classifieds, and people use it as a way of selling their car, as a selling point. So they'll say one doctor owner,
Wow.
and
Okay,
I think that's definitely the car not to buy, mate. It's like they don't look after that. It's like, believe me, you know, and just find it amazing how things like that are still.
yeah. Well, it's worse in our culture, you know, in the sort of Arab culture, because if you're a doctor,
Mm,
that's it. You're like everything virtuous, and it was so draining. I mean, that's something I couldn't handle when I was in Iraq, because I was a doctor 24/7,
sure.
and I couldn't not be a doctor. You know, I couldn't sort of go out there and do crazy stuff. I mean, I
Yeah.
did, and people thought I was crazy, and I was just, you know, riding in a normal car, wearing normal clothes rather than a suit and tie. And
Yeah.
I thought, what the fuck are you riding? You know, you're not wearing your suit and tie 24/7,
Yeah, yeah.
and it was crazy.
It's like
It really drained me.
I'm sure it did. I mean, it's like meeting your when you're at school and you see one of your teachers in the shopping centre or something, and
Yeah.
they're just wearing normal clothes, and you're thinking, "Oh,
Shock.
This
Sir,
person
what
has
happened?
a life." You know, it's
What happened, sir?
Yeah.
Hello, sir.
Yeah.
And they must get so pissed off, you know, these sort of people coming over to them. Hello, sir. How are you, sir?
Yeah.
And you know, oh, are you buying some condoms, sir? Oh, that's interesting, sir. And there's always a few idiots out there who always say the wrong things. I never used to say I was such a good boy in school. Such a good boy in school.
I can imagine that actually
Such
to some
a-
extent, and then
yeah.
I can
And then
also
I lost the
imagine
plot, I think.
I can imagine the rebellious phase coming in. And
Well, you know, you read the first chapter. I mean, that
Yeah.
was the start of my descent. You know, saying no to the wife and telling her to piss off.
how long ago was that?
It was a bad memory, actually. I've forgotten it. I don't know, 2015, I think.
Yeah.
Yeah, it was a very traumatic memory for me.
Yeah. Again, it just goes back to saying how the one thing you say one thing.
Yeah,
and
but it's how you feel sometimes.
yeah,
You know, and but it's
yeah.
all temporary. It's all temporary.
Yeah.
And, yeah. So yeah, go out there and experiment, guys. I think you know there's not enough experimentation. I mean, we're experimenting right now, aren't we?
We are. I mean, this
you know,
is
with this sort of conversation,
ad hoc.
ad hoc conversation.
Yeah, we did that last time, and that was the first time we'd met face to face, and that was it was quite an experience for me.
Good.
I must say.
And you even edited that, and I thought, come on, man, don't edit this stuff.
Yeah, that was. I was quite shocked.
What, when you edited it? You know,
Yeah,
the
when I
feeling
went
that you
through
got?
it, because I left here thinking this is brilliant, and
Yeah.
and then I got home and I can't remember what we were meant to be talking about, and I realised that I don't know, you know,
It was that logic thing that sort of took over.
It was
Yeah,
the logic thing that took
Yeah,
over,
yeah.
and so I was trying to move things or edit it in a way that actually meant we were talking about,
Yeah.
you know.
I'm so uneditable, apparently.
Have you been
Difficult
told
to
that?
edit. Yeah.
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 I can vouch for whoever said that.
So you know, when I'm on live TV, I have to be really, really cognizant of what I'm saying, because I
Yeah.
could go off and, you know, have a an orgy rant, you know, verbal masturbation
Well, you know, it's
rant.
But when I look back and see how popular that episode was, and also I've had people say to me, I really enjoyed that one
Yeah.
episode. And
Yeah,
it's
with that
like,
crazy doctor.
yeah, with and I'm like,
Because it's natural, you see. It's like a natural
yeah, it
kind
was,
of
and
up and down, awkwardness, flowing, that worked, that didn't work. And what people are looking for now is that sort of realness and, you know,
yeah.
I know we use this word all the time, vulnerability, but, you know, just sort of, what's going to happen next?
Yeah.
What's the next fucked up thing they're going to say?
I must admit, I have no idea what
What's
you're
the
going to
next
say to me
unpolitical
next.
shit that's going to happen next?
I genuinely have no idea what you're going to say.
And it just shows you how much conditioned we are in all societies, not just this society.
Yeah.
You know, how we've been brainwashed into thinking in a particular way and being hypnotized by all these different, very powerful hypnotizing forces.
Yeah. So, to summarize, really, we've talked about hypnotherapy.
Yep.
We've talked
Do it. It's interesting. Look into it. It's worth studying about.
Yeah. And we then did talk a little bit about relationships.
Which is very difficult, but you've got to lump it and see where you get to.
And finally, we discussed what I think we had actually set out to do, which was talk about the different personality traits within specialties in medicine.
Fluidic, mate. It just keeps changing. So, you know, let go of that rigidity that you have to be this because you're this.
Yeah. Thank you, Haider.
Thank you, Paul.
That concludes our last episode for the series and for the year. I would like to take this time to thank all our guests who have appeared on the show. And also, I would like to thank everyone listening for all their support, all the emails and all the positive feedback. And it's been a wonderful experience for my first podcast, and also for the last few months. It's just been absolutely fantastic. So thank you very much. If you do have any topics that you'd like me to discuss for next series, please do email me at adoctorsview@gmail.com. Please do visit the website adoctorsview.uk and you can leave me a comment there, and also I will get back to you as soon as I can. As always, please look after yourselves, and I'll join you again next year. Happy holidays and Merry Christmas to everyone. I'm Dr. Bolivios. Goodbye.